You're not firing some hot water today. How are you feeling, fellas? It's a beautiful Sunday. It's beautiful here in Arizona. I don't know about where y'all at, but I'm feeling
Yeah,
way more
it was
sunny.
definitely a beautiful day. I in North Carolina at the moment, visiting some family during this recovery period, and the weather been great. Been great. We didn't experience that Boston cold craziness. Been like in the 60s, 70s, so can't really complain.
Fair enough, fair enough, fair enough, fair enough. Tariq, how about you, man? How you feeling?
Pretty good. Pretty good. Today was a long day, but we got a lot done and made some progress on some stuff. So that's cool.
I was joking with that man in the group chat when we had meet the other day. I was like, man, it's so weird talking to this man. It's like you talking to Biko. The mannerisms, our voice. That shit kind of weird, man. But Brian, talk to me, man. I got the Wu Tang vibes. Did I like it?
It was a good day here home, Chill out for the most day with moms for Mother's Day. Yesterday was her birthday, so I just double up and then spend the rest of the day just chilling. So,
You said double up on the gifts.
yeah, it's on.
That'll be rough, my son. But I saw something on Facebook that I wanted to bring up. So there was this post that went viral about this guy. He was a teacher, younger, probably around our age group. He was teaching, and I guess during a break, he had his female students, the females in the class, braiding his hair. I guess he established like a relationship with them, and they do these kind of things, and he posts them on TikTok and so forth. And apparently, the parents and stuff they follow it, and according to the story, nobody was complaining about it. But when the post went viral, I guess the school got involved, and social media is going to do the thing. Everybody will give their opinion, and the
Hmm.
teacher ended up getting fired. I wanted to know what is y'all takes and y'all opinion on that situation. Like, do y'all feel like it was appropriate, inappropriate? Would you allow that for your child? Would you be comfortable with that?
Mm. And personally, with my daughter, I wouldn't be comfortable with her messing, braiding, plaiting a grown man head in school. I mean, I don't think I might be overthinking, too protective, but I wouldn't be comfortable personally with that.
Fair. If it was a woman, does that change?
If it was a woman, I may, I guess it would.
Mm.
Technically, yeah, I think I would be more comfortable with my daughter playing in a woman's head than with a man. That's just me.
Fair enough. Fair enough. How about you, Brian or Terry? Whichever one want to go first, essentially.
It's a ticket. Let me hear what he got to say.
Yeah, now I think 'cause I saw a video, I saw the post, and I did think about it. This is a poor boundary, really. Like
Mm-hmm.
even if it's not like anything like sexual, like there's just an
Hmm.
inappropriate boundary. Like this is the teacher, this is the student, and there's like a professional line that like you just don't cross. Especially like
Right.
for these kind of reasons, like you know how people could take one thing and interpret it something completely different. Like
Yep.
as a professional, like and somebody on social media, you gotta think about like what could actually happen and like how big this could have get. Um, yeah, so there's definitely a bad call on his part.
Yeah, I didn't think he think that one through too much. Brian, talk to me.
Right. And like what Tarik went with, it's all about optics. Yeah, he may have built this relationship with the girls and they felt comfortable to do this. Who knows how long it's been going on? But it's just like, it goes back to, I guess, the time we live in. Everything doesn't have to be recorded and captured. They could have been doing, I don't know the reason they're doing it here. I don't know if they're practicing for cosmetology class or not, but it was a little too comfortable, like you said. I mean, he and their cosmetology teacher in his class. And it's not like it's one. It's like all of them playing up in his hair, like the fire said. So it's like it's a bit. It could come off uncomfortable, and there's a little bias because if it was a female teacher, they'd be like, "Oh, they just helping her out." But it's a little touching. Like the social media just took it and spun it into something big and was because then I saw other teachers who rallied behind him, even other males who also got their like locks redid, some got their hair cut. So they start
Yeah,
posting
yeah.
it in support of him. It says like, why was there no outcry for those teachers? Like why was it specifically him? And it's just
Mhm.
probably just because his video blew up the most.
I hate when they
I
do
think
that.
it's just a problem in general to be recording people kids without the parents' consent. I mean,
That's
I mean,
in a
facts.
school,
apparently,
especially in a school setting. I mean,
apparently
I
in this
wouldn't care for
case,
somebody to do that.
apparently in this case, some of the parents did follow him and stuff, so the parents were cool. But
Yeah,
I
like
look
and
at
this wasn't a first. Like that's what we were trying to say. Right? This wasn't his first occurrence posting something like
Hmm.
this. So it's just this one that went. Like that was the one that hit.
Right.
But I agree with you. I think it's a level of professionalism. So like while I saw it and I didn't think nothing extremely negative about it, like I know that they had the stuff talking about grooming and so forth, which is very realistic fears, you know what I'm saying? I know people saying this is your childhood trauma, but these is real things that really does happen. So like where do we draw the line? I agree with Tariq when he was saying it. At the end of the day, you're a teacher. I understand you trying to create that environment where your students could be loving and have that good kind of environment. But at the same time, I think we crossing the line when you braiding my hair in the classroom. Like if that was Nalan Amani, my daughters, I'm not having it. Though I wouldn't think it's like a danger. I just don't like. I'm not sending you school to braid
Really
a teacher
saying.
hair like they say cosmetology class. You know what I'm saying? And then for the people who saying it's not that big of a deal, they have to look at it as well as first the school itself because it's cool when it's the one teacher, but then when everybody start doing it and then now something does happen, it's gonna be the story is gonna be they should have nipped that in the butt. Oh, what the policy say and so forth. You know what I'm saying? So you put a school
Exactly.
in a bad predicament. So when they fired him, like people say it wasn't a big deal to fire him, but you gotta kind of nip that in the butt before the event happens. In my opinion, at least before we get to that point where something bad does happen or
Hmm.
whichever parents, because not all parents gonna think it's cool. Other parents and other classes looking at it like, oh, that's what we're doing in the school, and now the school looking bad and not half. So I agree with y'all. I agree with y'all.
I
I ain't
do
going
think
for
that
it.
firing didn't have to be the outcome though. I mean, a lot of misunderstanding. It was a bad choice, a bad call, misjudgment on his part.
But
But
our
like you
boys
said, a
don't
lot of
fire
people was
too.
fine with it in the beginning. Parents were fine with it, but so I feel like there could have been a different type of punishment outside of just a full blown firing,
I could agree with
especially
that.
since it was a lot of people co-signing it from the jump, already knowing what's been going on from the jump.
Hey, when that pressure from from
Yeah, from up
sponsors
above.
in
Yeah.
school,
For the
social
high
media
ups
hit
come.
you.
Yeah, that's the power of social media, really, and with things being seen by millions of eyes, millions of opinions could shift
Yeah.
mountains, really.
True, true, true. Well, thank y'all for giving your take on it. I'm gonna continue the debate on social media about it because I think it's an interesting topic. Yeah, I've been taking on some debates on social media lately, uncharacteristic of me, but I had some time. Not today specifically, but yesterday I had some time. Tomorrow I'll probably make some time and go interact with the people. But without further ado, man, Tafari, you know what you gotta do, man. 'Cause I can't do it.
Y'all blaggers don't know now. It's your boy Faray, and thank you for coming through to come through the podcast.
I already know the vibes is come true. I'm going to be your host today. You already know it's the luxurious, the bearded. Today I put a little oil in my beard so she a little shiny a little bit. You know what I'm saying? But it's your boy, Deshaun Webb. And here today I got my team, as y'all heard, the Yagazao. I got my co-host today, far right per usual. Then we have the resident voice, my boy Brian. What you saying, dog? Ready for today?
Yo, good to be back. Good to be back.
We have a very, very special guest today, man. I was looking forward to this month specifically. For those who don't know, it's Mental Health Awareness Month. And I know that Come True is gonna come with some bangers for this month. And I wish it in my mind and I pray for it to have this guy on the platform. Brian reach out, was able to make it happen. Today we have Mr. Tarik McMillan, man. And before you go, just want to let the people them know about you. So Tarik is a licensed professional counselor in the Virgin Islands, as well as the owner, so entrepreneur here, the owner of Greater Changes, which is a behavioral health agency specializing in culturally intentional mental health services. I like tell you word that intentional. I all about being intentional about everything we do. So I love that. But greater changes operating in the Virgin Islands, Florida, and New Mexico. So we're in some different locations, man. Big up yourself, Tarik. How you feeling? Thank you for gracing us with your presence today to having this conversation and shedding light on some issues that we feel are very important for the community, for the culture, man.
Yeah, man. Thanks for having me. For real.
Of course, of course. You want to say anything about your business, or you want to save that for the
Uh,
end?
no, I just very briefly because I always make sure to shout out like I'm one of the co-owners of Greater Changes. So I run the business with my wife. She is the clinical director, and really one of the best human beings and clinicians I ever worked with in my life. So um, yeah, so like shout out to Tamara.
Big up, big up, big up, big up. Respect that. But we're gonna jump right into it, man. I wanted to start off in the beginning with just being able to break down the stigmas around therapy. Because usually when we bring up therapy, especially in the black community, and especially amongst black men, everybody kind of have this stigma and the cultural stigma in the Virgin Islands where they don't really want to go to therapy for this reason and that reason, and this person will share melee. So I wanted you to shed a little bit of some light around the misconceptions and then from our angle and the ones you see from your angles. Obviously, you're in this space, so you might hear different things that we're hearing. Can you talk a little bit about what you've heard and what your advice would be for someone who is hesitant based on those stigmas or cultural beliefs?
Yeah. So one of the things like I have a few presentations I had to do. And I usually start off by highlighting the fact that the stigma toward mental health that we have in the Caribbean, like it doesn't belong to us. Like that's not something that like we create. So when you look at like the history of mental health in the Caribbean, you'll see that like Europeans brought their like mental health asylums, and they brought like their negative beliefs about people that have mental illness to the Caribbean. Um, and then as time went on, and we started to like dismantle some of like the beliefs about colonialism, like the asylums left, but a lot of the cultural beliefs about it stayed. So
Mm-hmm.
looking at people as like just like different or other than us, like
Hmm.
that doesn't belong to us. Um, but a lot of the things that lead to people not wanting to like engage in therapy, one has to do with not wanting to be judged, not wanting to be viewed as like this weak person who need to go and talk to somebody. Therapy is a white person thing. Like there's all um,
Yep.
these negative ideas about it, and I mean less so now, because like in the last decade or so we've seen a lot of people have more conversations about mental health, realizing like you're like we need a space to talk. You see celebrities come out and talk about their mental health journey and everything.
Hmm.
Um, but so that's on the one hand. On the other hand, like we do have this fear of like us going to a therapist and them like breaching your confidentiality and talking and stuff outside of that. Like, unfortunately, like the reality is like there are clinicians who like they don't respect confidentiality. Like that's just like the long and short of it. A lot of times, like we like not most people, but like sometimes we have like a negative first interaction with the healthcare system or mental health specifically, and it just like turn us away from it. And then now we have a story to tell somebody else. Like, yeah, I went to this therapist and they tell my business, and now that is what spreads versus like the person who like talked to somebody and like, yeah, like my therapist really helped me out with X, Y, and Z. So
Yeah.
it's just a unfortunate place to be in. And ain't all clinicians definitely, but like unfortunately there are like some people who just I don't even know like how you could be a clinician and just go and talk somebody business.
Yeah, that's
like
crazy.
I don't like, especially like, if you know that this person had to like give us so many barriers to even come to the room, and like for you to like just like that's just terrible. um
Yep.
but that's just some people. So,
I think that was one of the biggest things in the military, because in the military you're in a lot of high stress situations. So a lot of the times, military members and a lot of my friends and people, my co-workers, in my opinion at least, these people, some of these people really needed to go seek therapy, but that same thing existed like within your chain of command. Because sometimes when you go to therapy in the military, they take you off a certain duties sometimes, or things like that. So soldiers didn't want to go there like nah, because if they take me and put me in the what we would call back shop, which is off your original job, kind of something kind of little softer. Because in my career field, we was loading bombs. So as soon as you say you have some kind of mental health issue, they're gonna put you on a kind of a watch because they don't want you to be a flight risk. So just that in itself would deter people. Like I don't want to be that person where he's skating work to go to mental health and be in therapy, or he lying, or same thing they telling a lot of soldiers like, hey, this is this dude business. Hey, you see he going to therapy. It's like a bad notion behind it. Unfortunately, that's what have led, and I talked about it on the last part. That's what led for me for having a lot of friends who took their lives. You know what I'm saying? Because of those same things, because of those same pressures, and that they didn't want to go seek the help. So I'm glad you're talking about it. And I never thought about the fact that it wasn't given to us. It was brought to us, that mentality and some of those stigmas. I never even thought about that perspective. So I'm
Yeah,
glad you shared
that
some of
was a new thought. That was good. It makes sense though.
it. It does. It does. It absolutely does make sense. Tafar, what do you think?
Well,
Anything that you have heard?
man, I mean, similar to what you guys been saying. I mean, that therapy makes you weak. Therapy, same thing. Therapy is for white people. Uh, this is not something that we do. This is that's for them, man. It's always that we are not the type of people to need something like that, because I guess we're so strong and we can't be weak or can't show that weakness. And unfortunately, that is not the case. That's not true, as we all know. Now, we're human. We're all human. We uh, all have down times, and sometimes we do need assistance to reach to a better place, or to understand why we're feeling the way we're feeling and how to get to a better place. So hopefully, this this month of paths do help with that changing our perspective, because it is a very powerful perspective for people to have.
Yeah, I think mental health is the most important thing. But I want to go into the different types of therapy. So a lot of people not really educated, or they don't even go seek the education. I don't think people really talk about the different types, or even know that there's different types. I know you know like marriage and there's the one-on-one, but can you shed a little bit of light on the various types of therapy, and then give a little bit of an explanation on how one would choose the right type of therapy for them?
So generally, there's like individual counseling, there's group counseling, marriage and family. That's like generally it. Like for the types of therapy.
Mm,
Hmm.
When you look at like therapeutic approaches, you
mm,
have people who. So for me, I practice trauma focused cognitive behavioral therapy.
okay.
So I I'll say that that's like my core, but
Hmm.
I pull from like different approaches. Sometimes like one approach don't work for everybody. There's some things that I like about other approaches that just like fits really well.
Mm,
So that's how I practice. I'm very A lot of the sessions for me begins with this one understanding that like this person who's come into this room or on the screen, because I do telehealth sometimes,
mm,
is like they've had a completely different experience that I need to understand for us to
mm,
be able to do work together. So this person's culture play like so going into like the cultural intentionality, like making sure that I understand that this person's culture isn't just like this off to the side thing that can come up sometimes, but like
mm,
this culture that this person lives in dictates their worldview. Um, Interestingly enough, when I first started doing this work and we started talking about like culture and intentionality, for me, like, I was just thinking about like Caribbean culture, Virgin culture, because you found the Virgin Islands, I could understand how like some of the things that you've been through.
yeah.
But the more you go into the work, you realize like there's so many like different like
Subcultures, yeah.
subsections of yeah like within Virgin Islands culture.
Hmm.
So you like I saw this post the other day. I said that it was like maybe like 2020, like during like I think some of those like the George Floyd protests and everything, and I
Mhm.
saw this person talk about police brutality not being a thing here in the Virgin Islands. So like why we want to get involved with these protests, and then I saw people who and a lot of it was like I think people from Frederick said who was like yo like I don't know what you're talking about because I've seen the police drive my cousin and slap walk up and just do whatever they wanted to
Yeah.
like police brutality exists in this space. So like when that person comes into the room, like I have to understand like they've seen a lot of different things that the person who ain't experienced police brutality, like they haven't experienced. But at the same time, like just because they haven't experienced police brutality, that don't mean that we can like have a conversation about well what was going on for you 2017 well the
Mhm.
hurricanes and now we like now there's like all these similarities that we could talk about but like there's just so many different subsections of Bajana's culture like the person who grew up with I was a father the person who grew up with a father the person who grew up with in a two-parent household versus
Mhm.
the person that didn't the person who grew up playing sports so like there's all these different things about it that like Bajana's culture and doing mental health work is just like it's this really really interesting space to walk in um you asked me about different types of therapy
And
um
then essentially how should one go about like choosing what type of therapy is for them? Like for example, you say you specialize in trauma. Like how does one go about kind of choosing a therapist in that sense?
So for me, I always tell somebody like, um, before you like, you don't have to commit to a therapist in your first session. Like most therapists offer like a free consultation. Like take advantage of it. It's like a 15-minute, maybe 20-minute conversation. Um, like ask questions about like how they practice like what's their perspective on addressing trauma what's their perspectives on social justice issues how do you build rapport with a client that you have a different culture than them like so asking these questions and really getting to know them is really important because as I feel like I'm a great therapist but I'm not a great therapist for everybody like there's some people who like we won't work. Like it just that's just how it is. And it doesn't mean that like I'm not a good therapist. Just like there's something about me that don't fit. Um if like I've had clients where the issue was let's say it was abuse and
Mhm.
um it was by a father figure or a male that had locks right? So like you could see how like this could be triggering for somebody to come into
Yeah.
this space and be talking about it. Now, granted, a lot of times when those things have come up, like I address it immediately. Like, hey, like this is the issue that you came in with. I am obviously a man from St. Croix. I have locks. Like, how do you feel about being in this space with me? And sometimes the client is like, well, I thought about it, but hearing you say this makes me feel a lot more comfortable because you were thinking about it, But like sometimes the client would be like, "Yeah, I don't think this gonna work out," and that's cool. Like you find another therapist. Now that becomes difficult because in the Virgin Islands we do have a shortage of healthcare providers. We
Mhm.
don't have enough counselors for the amount of people that we have here. Um, and that's such a scary place to be in when you consider like all the issues that we have here um, like
I
high
agree.
rates of suicide and depression and anxiety you train hurricane season you train the fear of a pandemic you train the fear of gun violence and like now you can see like we have all these compounded issues and not enough care for it.
Yeah, it could definitely be crazy. I'm sure is nerve wracking as well because now you have a overwhelming. It could lead to you having an overwhelming amount of clients that you want to deal with. Have you ever run into that where it's like, okay, you know what? I myself kind of getting overwhelmed with the amount of work, and you have to take a step back. Have you ever run into that kind of situation?
Yeah, for sure. I've very early in the beginning. And I think most newer clinicians the make this mistake of like going in and being like I could do 40 sessions a week and I'll be fine because if you break down 40 throughout the week like that like you could see how it could work just from like the numbers.
Mm-hmm.
But I feel like clinical a clinical hour is not
Mm-hmm.
the same as like an admin hour.
Mm-hmm.
Like you could have like the most intense admin job or any other job that requires a whole bunch of focus. Um, but like in this field, like you are taking in like so much information at the same time. Like for me, I'm looking at how how the person mannerisms are in the session. Do they flinch when I say a particular word? Do they are they like is there a change of tone of voice when they talk about something else? Are they like having like shallow breaths as they talk about something? So there's all this information, and then I also have to like keep myself in check because
That's a
like
question I would have. Yeah.
yeah, go ahead.
But like based on what you said right now, it kind of spark a different question. Like I guess you could answer it on the end of your statement, but like how does that like I guess affect you because you're taking on just not, it's not 40 sessions, but you're taking on 40 personalities, and you have to be hyper aware of everything you say, how you do. Sometimes I guess even your movements when you're having these conversations with them because you don't know all these things may play an effect. So like how does that I guess impact you, I guess beginning and then know how to taper that down so you could give the best service.
Yeah. So it was. I think it was a little more difficult in the beginning.
Mm-hmm.
Um, so I've been a therapist now since 20. I want to say like 2015. Um, and so like fresh out of grad school, doing it is like it's much different than now. Like, um, I'm trying to look at all the things that I read that day and bringing it into my session. So I'm not like fully aware of all the stuff. Um,
Mm-hmm.
but now there's like I don't know like I don't want to call it being numb, but like
Mm-hmm.
there's an ability to like turn off the emotional response to the
Mm-hmm.
things and do the job. Um, like so for me, like I primarily like most of my clients have um like some kind like there's some kind of trauma involved in the work that I do with a lot of my clients. So like I don't think there's a thing that I haven't heard of yet. Like
Mm-hmm.
there's so much like so much of the things that happen in the world the be discussed in my office.
Mm-hmm.
Um, and I'm at a place now where it's like, okay, you could like it's just doing the work. Now sometimes there are things that's like they'll hit you like you just didn't expect it. Um,
Mm-hmm.
so for me, um, like if I have to work with like a younger person and they talk about like being angry and watching their parents break up and how that's been for them, like I have like it'll hit me like there's been times where like wow man I don't know if I could really finish this session because like this
Mm-hmm.
is tough like I've been through this before,
That's right.
but at some point like it becomes like I mean like how do I use my understanding of what this feels like to do the work even better,
Mm-hmm.
but that'll just come with time like so
Right,
like
right.
it just come with time.
Yeah, I could assume like the more experiences, and I guess I'm making an assumption that without like sacrificing confidentiality, I'm sure you're taking some of the stories from not taking the stories per se, but the things that you hear from other people and then bringing it into your other therapy sessions. Because now you have like essentially like an encyclopedia of different situations, different reactions, different things that work. So you're almost like a superhero dog, to be honest. Because
No,
I don't think
so
people
like
put enough importance on it
yeah,
and
it's
mental
like
health therapists and so forth.
I had a colleague the other day made this statement about like self care as a counselor. Like you have to practice effective self care as a counselor to be an
Mm-hmm.
ethical counselor. Like
Mm,
because there's so much that'll happen. Like if you let yourself get burned out, like you don't show up for the client in the way that you need to, and that was tough for me to learn because in the beginning, and I was actually in a conversation, another podcast yesterday, um, talking about. I didn't go into so much detail, but um, when I think about where greater changes started, um, it was actually so right now I'm on Hospital Street in Frederickstead. My first office was like I guess like a block up from here, and at that point I think we were making like $35 a week. Like it was just me, and I just had one client, and that was what I was doing. And it also happened to be the point in my life where like I just wasn't financially stable at all. So there became a point where like I would be trying to get as much certificates and expertise in all of these different things to be able to get more clients and just keep on doing work and keep on doing more work. And then you find yourself with 40 clients and it's like, yeah, doing this. We have like this hustle culture where it's like, well, I could sleep when I dead and I don't keep on going. I don't keep on going.
Yeah.
And
Mm-hmm.
and and
Yes.
then it's like
Definitely.
you realize like you that's not sustainable. Like you
Yeah.
cannot do that. Like I would tell Biko that and he'd be like, yo, like you don't get a stroke. Like that's how this goes. Like you have to give yourself a break, And it's just things that come with like maturity and understanding and like just not wanting to burn yourself out because yeah, you ain't doing nobody no good.
And that's not even something you even really consider the well-being of the therapists themselves. You usually think that they're just always in a good mental place, but that's a good perspective to bring to light that you are human too, and you do have to keep your mental health straight. And then you did say something early on that I did want to reiterate, like the fact that the first therapist that you go to might not be the right fit for you, and for the listeners who's considering it or haven't considered but might consider after these pods, yeah, don't let that discourage you if you do go to a therapist and feel like you didn't get anything out of it or you didn't connect to that person that you were opening up to and speaking to, because that may have just not been the right fit for you. So just wanted to reiterate that.
I had to tell people like you get really sometimes you gotta break things down and think about it. First of all, you need to understand how important your mental health is and how important self care is and these things. And then when you get discouraged, like do you get discouraged when you go from I mean you do, but you will have like 14 girlfriend in your lifetime. Give the therapist a chance, you know what I'm saying? Like go out there and and if you're serious about your health, go out there and be intentional, like, hey, this didn't work out. Okay, boom. And to me, I like to ask even the people that are, well, if they're good therapists, I would say, I would ask them for recommendations of other therapists as well. I don't know if you ever run into a situation
Mm-hmm.
like that, Tariq, but I would ask like, hey, I don't think we're really a good fit, but do you know of anybody else that could do this or that may
Yeah.
I
Who
could
may fit
talk
my
to?
character? Yeah.
You know what I'm saying? And
Yeah.
they might give a recommendation. Have you run into a situation like that, Tariq?
Yeah, for sure. And like for me, like I take referrals like really, really seriously. So like I have to know like I'll say like yeah, like there's this provider and there's this provider, but I'll also say like I've had people that I've referred to these providers and they're amazing. Like I could vouch for these providers. Like they respect
Mm.
confidentiality. They're gonna respect your culture. They're gonna make time for you. You're gonna feel like you're in this cookie cutter system and they're just doing whatever they have to do. They ain't gonna like rush to diagnose you and all of a sudden you just gain your insurance bill. Like like I'm like I take because it's my wallet. Like and if I give you if I refer you to somebody who's a terrible therapist or who don't really like have their heart in the work, then the next your next conversation is well my first therapist didn't work out and then they referred me to somebody else and that was terrible. I ain't going back.
Yeah.
It'll take a lot to even get into the room, like, and then to share all these things with somebody who you don't know. Like, that's a tough space to be in.
I want to double back as well. This got me thinking because I've been through therapy and I never thought about this person is looking at how my tonality. It's almost like sales. I've been in sales for a while, and essentially the same things that we kind of doing now that thinking about it and you bring it up, it makes sense. Like looking at the person's body language, how they say certain things. I never really thought about that aspect of it, like, hey, these people really, you have to really like gauge because a lot of things they're saying, they don't know how to explain certain things, or they could be lying. They could just come into a therapy session and just lie. So you really got to essentially uncover the truth. And sometimes maybe the body language and stuff and how they react to certain things you say, maybe that is how you kind of uncover the truth. Thinking about it from my perspective, obviously, I ain't no therapist, but that makes sense in my head at least.
No, so that part's important. Like for me, if a client lying to me, like I hardly care that they lying. Like I more care about like what's going on in this relationship that you feel like you have to lie.
Like why you have to like, yeah.
You know, because it don't do me no good to be like, yeah, you lying. What you lying for? You know, but like let's build a relationship and like make you feel more comfortable. Because what I tell clients in the beginning, like, yo, like you don't know me from anywhere. Like, don't just trust me, like let me on that, like let's have some conversations first and get to know me, and let me earn that, because if not, then you could be the most skilled therapist in a particular approach, but if you can't build a relationship with your client, then like
Mhm.
it don't do nobody any good.
Right.
That's real. That's real. So we looked up the most frequent questions. I like to make sure, well, I won't say me, but we like to make sure that we leave people like actionable things and then answer the questions directly. I want people to be able to come check out, let's say, this episode, check out this conversation, and okay, the question I had in the back of my head was answered for sure, and get them to the next point where they can make a decision, whether they want to move forward and seeking some counseling or just anything in general in life. So we looked at the most frequently asked questions. We'll start with the first. Brian, you want to read the first one?
Yeah. I mean, you kind of touch on it, but I want you to go a little deeper. So, you say you had the free trial moment. Like, I walk into your office, hey, Tarik, where we chop it up for a session. But after we get past the meet and greet, what can I expect from my first therapy session?
So the first therapy session, I guess it varies really from client to client.
Mm-hmm.
But generally, I want to get to know you.
Mm-hmm.
I want to build a relationship and find out more about, like, more context. Um,
Mm-hmm.
Very first thing, I'm talking about the, I guess, like the limits to confidentiality.
Mm-hmm.
Like, like the things that we talk about, completely confidential, with the exception of if you wanted to hurt yourself with somebody else, if there was abuse of an older person or a minor, um, like those things I have to report by law.
Mm-hmm.
And then even that gets a little tricky. Like if the person says, well, I have had um, a suicide attempt in the past, and sometimes I have suicidal ideation. Well, now I want to dig deeper there, and like not to get full context, but I want to know, is the suicidal ideation something that like it comes up when you feel overwhelmed, or is it something that comes with like a plan? Do you feel like I know how I'm gonna do it? This is exactly the steps I would take. Because then we're having a different conversation.
Mm-hmm.
Um, and that doesn't mean that I'm saying, okay, I need to call the police to put you in a hospital or whatever like that. But it means like we have to have a conversation of what are the supports that you have around you to keep you safe. Um,
Mm.
I've had situations where the person, they didn't necessarily, it didn't come from my office, but
Mm-hmm.
before they got to me, they had like there was maybe like an attempt, or they felt like they couldn't be safe, but the experience in going to the hospital, like it was traumatic. um, so now we have to have a conversation about like how do we manage these things, how do we navigate keeping you safe, but also keeping you from being re-traumatized,
Mm-hmm.
um, in a situation trying to keep you safe. So that's one part. So if those things aren't there,
Mm-hmm.
um, I'm telling you about me. I'm telling you about how I practice. I'm telling you about me being open. I think sometimes people come into a room and there's already like a power differential when you get into the room. Like it's like therapist and client.
Mhm.
and I'm trying to show you like I know clinical stuff. I
Mhm.
don't know your life. You're the expert in your life. Let's talk
Mhm.
about the goals that you want to set and how we could work together to get there. Um, I'm letting you know. So this is me. This isn't like you
Mhm.
don't get it. So like every single therapist, because like everybody have different
Yeah.
approaches.
True.
Of course.
This is my approach. Um, and I'm letting you know that if I say something that offends you, like don't feel like you can't say nothing. Don't feel like you gotta keep that to yourself and you got kick you out my office. Like no, like tell me, Tariq, you said something that was offensive to me, and I want to talk about it. And let's talk about it because sometimes I don't know. Like I
Mhm.
don't know that this thing was a trigger for you, or like
Yes.
the same way how you don't know me, I don't know you either.
True.
Um, so
Right.
like that's a lot to expect there. I don't I'm hesitant to say like I don't want to rush to diagnosis, um,
Yeah.
because there's like for insurance purposes there's a need to diagnose to be able to bill.
Mhm.
But I think a lot of times like we run into this situation where we rush to give this anxiety diagnosis or we rush to give this ADHD diagnosis without like knowing more about the context of the person,
Mhm.
which is a real problematic space. But yeah, generally like that's my first session. Like you getting to know me, I getting to know what was the thing that led you into this room. We talk about confidentiality, keeping you safe. What are your support systems? What are your strengths? What are the things that don't work? Um, yeah, yeah, I think that's it.
Okay.
So it really does sound like a emphasis on getting the client comfortable in
Yeah.
that setting.
But that
Hmm.
opens up, I guess, a sub question in the terms of the getting to know you. 'Cause as a professional, I mean, how much are you willing to divulge, or should you divulge to your client? Because I mean, just like you said, they don't know you, so they want to know something. Because some people, like, if you don't tell me nothing, they have that combative mentality. So like, they don't know anything about you. They're not gonna willing to share all their personal life with you. So like, how much are you willing to divulge to ensure this person is comfortable?
So it depends on like the person, and it depends
Yes.
on like where we are, and then it depends on like what the topic is.
Mm-hmm.
Right.
Like I've talked to clients um, about being anxious and being depressed. I've talked to clients about watching my parents break up and like how that affected me. Um,
Mm-hmm.
I won't go into like anything that I divulge has like some kind of clinical relevance that
Mm-hmm.
would like that helps the person feel more comfortable and builds a rapport. If there's no clinical relevance to it, then I won't. Because like I've been in situations as a newer clinician and
Mm-hmm.
like say something that felt like it was relevant but
Mm-hmm.
it really wasn't. And then the client is like, "Why are you telling me this for? Like, I don't care about this," you know.
Yeah.
But again, that's what time
Mm-hmm.
and being a little more mature.
Mm.
Nice, nice,
I
nice.
respect it. I want to do our next one, and you kind of answered it a little bit. But so I'm gonna just ask the second half of it. But when would it be a good time to consider a different therapist? Like, what does that kind of look like for the person? If you could give an example of.
I think so. In like an ideal space,
Mm-hmm.
sometimes okay. So first, sometimes you just feel it.
Mm-hmm.
Like I've had therapists that I'm like, yeah, this ain't gonna work. Like there's something about the the way that you did X, Y, and Z that I know ain't gonna fit. And then sometimes it could be like something like real petty. Like there's something about I don't know the way that you like why are you chewing gum while I trying to talk to you? Like
Mm.
we can't be like we can't
Facts.
be in a session if that's what you're doing.
Yeah, I gonna need a
Um,
next one.
so like so that's on one hand. The other part of it is like if you've talked about things that like if you've like voiced it like yo like there's something here that like I want to talk about X, Y, and Z, and you feel that the clinician ain't listening to you, and like after bringing it up, I'm bringing it up like say it like I don't feel like I'm being heard in these sessions.
Mm-hmm.
And if you feel like the clinician isn't receptive to that, and they like no, like I know what I'm doing, and they being the expert in your life, like it's definitely it might be time to change your therapist.
Mm-hmm. That makes
Mm.
sense.
Okay, question to pivot off of that one before we transition. You see, that could be the time to change the therapist, but like kind of gauging where Webb was talking about, like how do you as a therapist know? Because you talked about it earlier too, so I just want to clear that up. How do you know when to change your therapeutic approach? Like you can see that how
Right.
you're going about it doesn't work for the client. How do you know as a therapist, like man, it's time for me to change my approach because what I'm doing right now isn't reaching.
So I don't think I've had that with like an individual client.
Mm-hmm,
Usually, what happen is I actually was just talking to my wife about this like earlier today. Like I had to go through phases where I feel like I've reached like the end of this therapeutic approach, and like
mm-hmm,
it just it doesn't do all the things I need it to do. It doesn't
mm-hmm,
address all the issues I needed to address. Um, like I think in the very beginning for me, even though it's always been CBT for me, um,
mm-hmm,
cognitive behavioral therapy, like I there have been tweaks where like the thing that might have taken me 16 sessions to get done,
mm-hmm,
I feel like now as like a more seasoned clinician, I feel like sometimes I'm able to like get there in like 5 or 6. Um, so it really is just like it's not like a individual client thing. I just think like sometimes my approach like over the years like it doesn't feel sufficient anymore. um
mm-hmm,
or like I'll just be doing research and be like, oh, this actually sounds like it's more applicable to the things that I'm seeing more. um
mm-hmm,
like there was a point maybe like after 2021 where I started seeing a lot more clients that were dealing with anxiety, and it wasn't working to be like, okay, well, let's talk through this thing. So I did more work in like learning more about mindfulness and being able to explain why we should use it and why it's effective,
mm-hmm.
in a way that like sure it's part of CBT, but I just wasn't doing it like that.
Mm. I think that's what helped
So
me get past my little anxiety. I remember when I first had a panic attack. I was so anxious. I didn't immediately go to therapy. At that point, I wasn't in any therapy, but practicing and learning how to be more mindful is exactly what helped me with that. So that's interesting. I see. You know your stuff. You know your stuff. You know your stuff. Good, Fiery. Far
I
right.
was going to ask before I segue into the next set of questions. Just is there ever a situation, or have you ever been in a situation where the client themselves wasn't the right fit for you to address their whatever issues they had, and you then reference
Mm,
them elsewhere?
Absolutely, absolutely. There have been times where a client has they there's a diagnosis that like I that's just not my specialty.
Mm.
Like it's just that's not my training. And sure, I could probably go and get some certificates and do some reading and try and help, but the ethical thing to do is to refer to a colleague that has that specialty. So that's been there before. um yeah, because they have some clinicians will try and do it all. um
Right.
like yeah.
All right. So jumping into switching the vibe of the questions. So as part of the back to the cultural negative aspects that when viewing therapy, where they say you shouldn't go to therapy, you should more so confide in a friend, just talk to someone, you don't have to go to therapy. What's the difference between talking to a therapist and talking to a friend? What would you say the differences are?
So I think I have two answers. First, there's there's sometimes a bias that'll come with friends when you're trying to talk, um, and they know you in a way that could be helpful in one way, and then probably not in the next. Um, so I think that's the biggest difference. There's a bias that doesn't exist when you have a truly objective therapist that's trying to just like take what you, and it's hard. I want to say objective, but there's a little more nuance than that. But somebody who isn't allowing bias to come in and like dictate how they do the work. Um, the second part about this is, and again, me and my wife kind of like was back and forth today about it. There's like I think there is an an idea that's rooted in really like white supremacy and colonialism that kind of like says that I'm the expert, and in order for a person to be able to help a person, they have to go through the same kind of training that I've been through. um, I think in some respects, like there's something, there's clinical information that I've clinical education and work that I've done that makes me able to do certain things that somebody else who hasn't had that training can't do. But at the same time, it doesn't mean that there aren't different angles to healing that don't require going to grad school and don't require going through all the other trainings. Um, it, yeah, that's I think that's as good of an answer as I could give right now.
I think that makes sense. To be honest, I know people that talk about it a lot, where there's like, I'm unbiased when I give my friends advice. I don't think people realize how hard it is to really just be unbiased for real. Like sometimes you may think you is, but you have so much stuff going on. You don't see this person whole life. You don't cry with this person. So even though you think sometimes you're unbiased, just subconsciously, just because of everything you've been through, it's a little bit harder for you as a friend to give a friend of yours some unbiased information. And like you said, on top of the fact that some of the education things lacking. So though you may even know probably how to help them in a sense, you don't necessarily know how to say it the right way or how to get them to open up to take the information in or so forth. So I can see what you're saying. That makes sense.
Right. And I do feel like sometimes a friend just does, many friends, I wouldn't say all, because I do think that some can be unbiased and actually give good advice that could help. But I, I I feel like some friends just lack the ability to be neutral when it comes to being friends with that person. Just because you are friends,
Hmm.
whether you know it or not consciously, that you will create that bias in some way or the other. So I do see why it's important to differentiate and to also be able to recognize when a friend is being biased, to be able to step out of that and not ask for advice, or even to voice your just make it known that, okay, I don't want you to be biased, I know this and that, to feel like you are, in having those conversations, if you want to start with talking to friends, because friends can really be helpful. I'm
Hmm.
not saying that they substitute professional help, but it's having those clear, unpolished conversations that could really help out. So on to the next question: how can therapy help me if I don't have a mental illness?
So there's a whenever I think about mental illness, or no, rather whenever mental illness is discussed, I think there's like the tendency for us to look at mental illness as like just on the extreme side of things, right? Like this is the person who like they having hallucinations and they have um, yeah, they're having hallucinations, or having all these like really chronic severe things happening. Um, but at some point, like we all experience we all fall on the spectrum somewhere with mental illness. Like I don't think there's a way to go through life and not experience something that's traumatic, or not 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 have the skills to deal with something that's completely overwhelming. like grief is a normal part of life, but sometimes like we don't learn like what's a healthy coping skill versus what's an unhealthy coping skill. Most
Mm-hmm.
times it's like, well, this is the thing that works, so I can just do this thing. And sometimes it's not like terrible,
Hmm.
but sometimes it's like this just that doesn't work. Um, yeah, I think that's like my short answer. Like we all fall on a spectrum, and just because like you're not in this place where you feel depressed or anxious, maybe you have like um, different responses to things that are now like maladaptive, and they're no longer helpful. That would be it would be helpful and beneficial to be in this like objective space with somebody who could see it and talk you through like, well, maybe this is a behavior to consider changing.
That makes sense. I want to jump in now. The question I have essentially is, or the frequently asked question, I should say. I'm gonna rephrase it in a way. And the question is basically how long should you be in therapy? And I think it's mainly the question is how do you measure the progress? I'm assuming, of course, well, I know the therapist is gonna have their way of measuring progress as well. But how can you, as the individual, essentially kind of measure your progress and decide, like, you know what, though I think therapy should be damn near lifelong, to be honest with you. But how do you know? Because obviously you have to pay money for these things. Some people, they can't really afford it or just barely afford it to get through what they need to get through. How do you kind of measure, like, you know what, all right, how long should I stick doing this, or when it's time for me to say, all right, go get out of it?
So I don't think there isn't a number, right? There isn't a
Right.
number that you could put on it. Insurance companies like they like numbers. They like the clinician that I'm going to do this in 12 weeks, and then call it quits because no, they're not paying for this. So like that's one aspect of it. Um, but it's just important to set goals and like clear goals. So if when you come into therapy, um, sometimes like you have the person who walks in and says like my goal is to be able to deal with these things better, and that's great like on the surface, but like what does that actually mean? Like I want to be able to experience this particular trigger and be able to regulate my emotions and not be explosive and not respond to these things that way, and then journal about it. So you write down like, oh, like this thing happened today, and I didn't have this response, or maybe I did, and now we have some more stuff to work on. But I don't think there's a set number. um, One of the things that, and I got this from my wife. She always said, she says it still, and like I just kind of take it, and like I've definitely stole that from her now. But my job as a clinician is to walk myself out of a job, because
Mm,
I don't want to see you for the rest of your life, because I want you to be able to have the skills to manage these things without me. And maybe we check in once a month, or we check in every quarter, and we talk about what's going on, what's changing, what you've noticed. But I don't want to be there every single week, because I think that's how um, I think that's you see that very often in um, other aspects of healthcare, where the
mm,
goal isn't necessarily to like give you the skills to manage the thing, is to be able to create like this dependency where like
Mm-hmm.
every time there's something going on, like you keep on coming back. I know I could build the insurance and build the insurance and build the
Wow.
insurance.
and
That's
Um,
that's
powerful there.
counterproductive because the point of
Yeah.
it is for me to be able to deal with myself, not I have to just keep coming to you now. There's just a different crush. Now you have a whole new different problem. Now it's only one person. You can't help yourself still. You know what I'm
Yeah,
saying? That
it's
makes
better to
sense.
yeah,
give a bandage.
yeah, and then I mean, to really dig into that, you have to have like conversations about like capitalism and
Yes,
like the mental
exactly.
health care like model and industrial complex about being able to like continuously build, um, like the bottom line to be about the money, um,
Really, honestly, that's
yeah.
really what causes that approach to health care.
Yeah, I think that's the most. I can't wait. Next month probably gonna do a capitalism episode.
Yeah, got to.
Can't wait for it to be honest. But can't leave a pod without giving resources. I've heard it plenty of times. We've heard it on this podcast itself about being able to afford therapy. or what's resources available. I could sit on here and say it's very easy, like, hey, you just go research it, but we know people not gonna do that. So I feel like we need to bring some of
Speak
it
out
to their
there.
forefront. Yeah, bring it to their doorstep. So, what resources would you recommend for someone who wants to learn more and possibly seek some help? Both I would like you to give like both paid and both free ones if you know of it, of any.
Um, so there is a there's a directory that I think UVI has. UVI and um, Department of Health has like a directory of, I think, all of the clinicians in the Virgin Islands. Um, I think so. That's like the first step. Find that list. But
Mhm,
it does take some work to like go through the listing of the therapist and like read it, like
Hmm.
read what's their approach, um, how long they've been doing this. Is this somebody like I feel like sometimes it's kind of weird. Like there's like it feels like a very like stalkerish kind of like thing to it.
mhm,
But like go find the post on social media. You know what I mean? Because the things that like me, I have a difficult time. Like I'm so hesitant in like sharing certain stuff because like it might it just it just weird sometimes when like a client sees this particular thing. Um,
True.
but it does help to be able to like, I don't know if I could work with this clinician because I've seen them share things that say white lives matter. What about like understanding the full context of those things, like,
mhm.
and given the nature of social justice and these kind of issues, like it's important to know where your therapist stands on particular things. So I always
Yeah.
do the research. Um, the other thing, and I think this speaks to a, a bigger issue and how we've kind of like done the work and understand the work now as greater changes as an organization. The There's much more of a need for us to be able to create digestible information about mental
Hmm.
health, because the bottom line of it is that not everybody is going to go to therapy, and
Mhm.
not everyone is going to have the access to it. Not everyone is going to. First of all, we don't have enough. So right off the bat, like there are
Yeah.
people who
Fact.
just like that just ain't gonna work. Um, there's some people that ain't gonna have the time because they're working three jobs and they have to deal with their children and they have all these things going on. Like they just don't have the time. Um, a lot of the information, like there's so much of the clients that I speak to, like when they when they go on TikTok and they see something about anxiety, we talk about it in a session, and it's like,
Hmm.
I heard this thing on TikTok, and this is what it was saying. And it's important because someone, like, there's no vetting that goes to these social media platforms. So like I could really say whatever it is I want to, and like, I mean, hopefully somebody see it and it's false and they like correct it in the comments. But like
Yeah.
that's not everybody. So just do like, it's hard to say like you have to do the research because like you may be going through so much different things that don't allow you the space to even be like to be there saying like, yeah, let me go and learn about depression today. But
Hmm.
like that's a part of it. But it's also like on our part, like our job to like this, like these kind of podcasts are like is a valuable resource because you're not going to go into a whole bunch of spaces and see four men talk about mental health in this way. Like this is digestible. Like this is relatable. This makes sense. This is like, oh, I could watch this and listen to this. And, oh yeah, this is actually very valuable to me. Um,
Hmm.
so this is part of the walk. So I don't know if I could give like a whole bunch of resources, but like the first thing, do do some reading, watch some videos, and look at the different therapist listings that you can find.
I, I tell people all the time, like, and as much as social media is a curse sometimes, it's a blessing, man. You could
Yeah.
really, and I said in the last part, you could really create an environment. Like, you could go follow six therapists right now and just have a platform, Instagram, where all you getting is information and anxiety, information and depression. Like you say, obviously you still have to go do the research and make sure it's the right fit for you. But you could do some of the things we talked about on this platform in terms of how you find a therapist and just go find a mental health creator using the same premises. Hey, this how this person I kind of talk. I like their vibes. Just take that mentality to the social media platforms. Do the research there. Just get them. I know most people is on the social media, so even if it's for 2 seconds, you have it in your ear, whatever the case may be, and you hear some of the videos, you watch some of the videos. It's very powerful if you be intentional. That's why I love that intentional is in your whole motto, you know what I'm saying? Because if you're intentional about it, you could really get a little bit of help until you could get to that space where you could afford therapy, whatever the case may be, or you have the time to do these kind of things. I want to highlight real quick what you said earlier as well, because we just talked about the last part, and I've been talking about it in life in general, the journaling.
Journaling.
Like on top of now, you have the social media. That journaling will help you a lot now, especially if you don't have the therapist to kind of help you journal.
Yeah,
Get
you
in your
gotta take your
journal. Hey,
notes.
I learned this today. Let me take some notes. So let me write it down somewhere
So
and and
how
and
it
put,
affect me? Come back to it. Yeah.
come back to it. You know what I'm saying? And get in the comment section. Like some of these create. I sure for example you're a creator, Tarik. I sure if they go in your comment section and mention something, you might kick them back an answer or give them something that they could run with. You know what I'm saying? So don't be scared. This is for the viewers. Don't be scared to while you on these platforms. Hey, say something. You know what I'm saying?
Ask a
Like
question, you may
um
get the answer you're looking for.
yeah,
Hey,
I'm in a
right,
ve- I'm in a
right.
veterans group, veteran to veteran, and I have people who come and put a whole real life trauma they going through in that moment in that group, and then they just flooded with different people. Some therapists, some just people who've been through the same thing. So just having the support group and just other people who going through the same that may just be enough to get you over the hump today. You know what I'm saying? Just knowing that there's other people going through the same shit like you and need help as well, so they have that support system. So go and join our Facebook group and go comment, man. If you take this thing serious and you're really serious about yourself, just like how we serious about other things, like you said, you'll be able to find it and read. I was beat reading like crazy, bro. Like you cannot go wrong reading, man. Like reading is one of the most powerful things we could do. Audio book. I don't want to hear that. I was just talking to somebody the other day. They say I ain't got no time to read. I said, bro, we sitting on this phone for 50 minutes, dog.
Yeah,
How
you
you gonna
could
tell me you
listen.
gonna time to read? Yeah, you
You
might
could
be doing
listen.
something, but I'm sure you could have listened to an audio book in the same 50 minutes we sit on here on the phone and talk about a whole bunch of nonsense. So um, appreciate you coming and talking about these things. I want to highlight and I give you the floor to highlight some stuff now. As well, before I even get into that, what made you get into therapy? What made you get into this space and doing these things?
Yeah. So I've been saying that I want to be a therapist since like fifth or sixth grade.
That's crazy.
Um, yeah, and
Yeah, that's crazy. That's dope.
I had a therapist when I was in Florida. So that was at the point where people were saying stupid stuff about being from the Virgin Islands. Like we live in huts and like somebody asked me if we would have swim to school and
I don't know
shit
why they
just like
think
that.
that shit is funny.
Yeah, but I mean,
That's a
I
good
could
one.
now reflect on and be like, yeah, that was just ignorance. They didn't know, and like some of them knew, and they were just being stupid.
Yeah.
But there
Yeah.
was a lot of bullying that happened like during that point, and like I responded to it. And
Mhm.
after a while, like I'm getting sent to the principal's office, the guidance counselor recommended that I go and speak to a therapist. Well, told my
So
mom
much.
go to a therapist. But when I got to the therapist, like he it was the first two sessions were great. The thing that stands out so much to me, he had like this Harry Potter. It wasn't like a toy. It was like this. It was two magnets and like the golden snitch like in the middle like was just like
Oh, to
Yeah.
hang
levitating.
up.
Oh,
Yeah, that's
yeah,
fire.
yeah,
That's
yeah.
dope.
That's dope.
Me, a huge Harry Potter fan at the time, um, and like so that catch me. I was like, "Oh, okay, this man cool, man." So I would get to talking, and
Yeah.
after a while, like I start talking in my accent, and the man just like he like watch he like he like laugh and like shit like so now I getting bullied and the thing that I come to talk about is people laughing at my accent when I do that he do the same thing and after that I was
Mhm.
like yeah I done
I
I
don't
ain't
listen, man.
talking yeah I ain't want to talk no more I ain't want to do therapy no more none of this but me I've always been like really competitive and I remember saying to myself like I know I could do this man job better than he like for sure for
Mhm.
sure and from then, I mean, there's been times where like I want to be a lawyer, I want to be a basketball player or something, but like
Mhm.
there's always been therapy. There's always been therapy.
True.
And then when I get to 12th grade, I had a psychology class, and
Mm.
I went to college, I studied psychology, and then I had this one class my senior year, the person centered counseling, and like it was all about like different techniques. And I realized a lot of the techniques that they were teaching, like I just used to do like just in my
Naturally.
normal day to day stuff.
Yeah.
And like it was like, oh, I could really do this. Then I went to grad school, and then like here.
The rest is
I respect
history.
it. I
That's
respect it,
dope.
man. So you got some things going on right now. You have the Caribbean Faces of Mental Health. I don't want to call it that challenge. What do you call it? Initiative.
Yeah, like a public health campaign. So
Yeah.
that the whole
Mm,
idea behind it is showing that there isn't just one look to mental health. Like a lot of us, because of the stigma, would keep these things to ourselves. So the
Mm,
person next to us don't know that like I also feel anxious and I also feel depressed and sometimes I feel overwhelmed. But the more we talk about it, the more we normalize the conversation. So the whole initiative is um, taking a picture of yourself and writing down in a caption like your mental health journey. So what does that look like for you? And maybe it's going to therapy, maybe it's not going to therapy. But whatever that journey has looked like, let's talk about it. Let's put it out there and like let more people know like it's not just you're not by yourself.
true. Come true. Definitely gonna be taking part. I'll drop my picture up there tomorrow
just
too.
like taking
Most of
photos. I don't know.
it is, man.
I love
Yeah,
that for
but we
you,
don't we
man.
don't think that's I think that's powerful. That's powerful and goes right in line with what we're talking about. Just to
True.
reiterate, this is Mental Health Awareness Month. Other platforms, I like to call it other platforms. I want to say I do something for Mental Health Awareness Month, man. I know you're doing entertainment and you're doing these things. Let's not forget these people that you entertaining and that supporting you. They going through shit, man. Hey, help us do what I think is as humans we should do for each other. Join us in talking about these things and talking about it on these platforms. And I know, just like you said earlier, is weird to see. Not weird, but you don't see it very often. For black men at that platform talking about mental health. You know what I'm saying? So I would love more black men to come out and do this. 'Cause I feel like amongst everybody, the black men, that's where a lot of the big stigmas really lie. You know what I'm saying? Us
Yeah.
just
That's
talking and
right.
coming
Yeah.
out and sharing our stuffs in general. So I empower all the other platforms to help us promote and help us get this word out there and help us put some of these resources in the forefront and bring these creators onto your platforms as well so that we could get this conversation even more started and get some actionable items for the people to really start making a change. Because right now, with the world looking at this economy, social media, now we get AI to come out here and fool you. It's getting rough, man. It's getting rough. It's getting really rough. And I feel like from my standpoint, mental health right now is boy is so powerful of a thing and the conversations needs to happen. Everybody need to be having these conversations amongst their friends group. And we need more resiliency now than ever, in my opinion. We need a lot of resiliency. And don't get me wrong, my opinion is a little different. 'Cause I've been through the military, I've been through this, I've been through that, but never know what somebody else going through, you know what I'm saying? So anything else you want to give us, you want to talk about your business a little bit more, where can we find you? What platforms we can find you on? How can people reach out?
Yeah. So the website is www.greaterchangesllc.com. You can request appointments. You can ask questions through the website. We were about to launch the blog in like maybe the next like 3 weeks or so.
Wow.
So there'll be
Okay.
information about mental health and everything there. Um,
Okay. That's dope.
we took a long pause from my wife and I from doing the Crucial Counsels podcast where we was talking about mental health in the Caribbean. Um, so we're gonna start that up again. I mean, anytime I see anybody who to do a podcast, I'd be like, yo, like them man walking because like none of this easy. Like none of this easy.
Man.
Like having to do the recording and then like have to plan the episode and then having to do the editing and
Oh,
like my wife I'd just thank the universe for this woman because like I ain't never meet anybody who could do as much things as she could do. Like when I tell you she is the graphic designer, she is the editor, she's the producer, um, like I mean, amazing, amazing. So I just know like learning a little stuff. Like I know how to use Canva now, so I could make some of the graphics. I still learning how to do some of the editing, so that gonna be a little bit, but like yeah, like that's work. The number we actually just changed the number like 3 weeks ago. So um, the new number 833-409-3474. Um, so we're on Facebook. We are on X. We are on Instagram. At Greater Changes LLC. Um, That's it. Some people like they reach out to me personally. Like I have people like ask me questions directly to my Facebook, to my Instagram. Feel like definitely feel free to reach out. Like I will never just like not answer. It might take me like a day because there's a lot going on all the time. Um, but like I'll never not answer a question about mental health. So
Bet. And we're gonna make sure we drop all the information in the bio, and of course we're gonna have some clips coming out, so we're gonna make sure we get the information out as well. That's something I've been failing at. See, it's a growing process of this podcast, man. It's a growing process. You learn as you go. You know what I'm saying?
Getting better.
But nah, man, give thanks for coming through. That's such a dope name, bro. Every time I say that, it's like, damn, this is such a dope name. But for real, give thanks for coming through, man. We really appreciate it, man. It was a great conversation. I took some things away from it that I didn't think about as well, and that I didn't know about as well. So I really appreciate you giving us opportunity to essentially interview you and have this conversation. And
yeah, for
kudos to
sure.
you
Thanks for having
for
me.
of
Thanks for
course,
having me
man.
for
And
real.
kudos for you for taking on the challenge, man. Because at the end of the day, like being a mental therapist, I know that shit is work as well. You know what I'm saying? I know dealing with so much different personalities while you have what you're going on, and to be able to say that you're doing something that's selfless. You know what I'm saying? Because it sounds like you really invested in this thing. I know you shared that some people are just for the money, but you said, hey, when the money won't even there, you was grinding, learning the information and everything, man. So kudos and big shout outs to you for taking on that challenge and helping form greater minds and help people get into whatever they get into and be a part for
Sure.
human
Yeah, give
race, man.
thanks,
Really
man.
appreciate it for sure.
For real.
Anything else, fellas? You like anything else?
I just like to reiterate, man, the mind is an extremely powerful thing. Having it in a healthy space is the best thing that you could do for yourself, because it's the mind that could get over anything else that you're going through, regardless of what it is. And having it in a strong, healthy place to make those decisions and to feel how you're supposed to feel. Um, I don't even know how you're supposed to feel, but yeah, having it in a healthy space is where you want to be, because it'll make everything so much simpler for your entire life, for those around you, just to understand that.
And with that, thanks for coming through, man.
Yes, I
Hey,
peace
man.
over the heart.
I'll later.